If you or someone you love had a stroke coming, would you actually recognize it? Not the dramatic version you see in movies where someone suddenly collapses. The real version, the quiet version, the one that can show up the day before, sometimes even earlier, and look so ordinary that most people brush it off completely. A little dizziness, a strange tiredness, a word that doesn't come out quite right. By the end of this video, you'll know exactly what to watch for, why these signs are so easy to miss, and what to do if you ever notice them in yourself or someone close to you. Stay with me because the third sign we cover is the one doctors say gets ignored more than any other, and it could be the most important few minutes you spend today. Let's talk about why this matters so much, especially if you're over 55. A stroke happens when blood flow to part of the brain is interrupted, either because a blood vessel gets blocked or because it bleeds. Think of your brain like a city and blood vessels like the roads that deliver everything the city needs to keep running, oxygen, nutrients, everything. When a road gets blocked, the neighborhoods that depend on it start losing power almost immediately. Brain cells are incredibly sensitive to this. Without blood flow, they can begin to weaken within minutes. That's why speed matters so much when it comes to stroke. It's also why the warning signs matter just as much as the event itself, because in many cases, the brain sends out smaller signals before the bigger one ever happens. Here's something a lot of people don't realize. Stroke isn't always a single sudden event. For a meaningful number of people, it's preceded by what's called a transient ischemic attack, or TIA. Some people call it a mini stroke. A TIA happens when blood flow to the brain is blocked temporarily, often for just a few minutes, and then it resumes on its own. Because the symptoms go away, many people assume nothing serious happened. They feel fine an hour later, so they move on with their day. But a TIA is the brain's way of waving a flag. It's telling you that somewhere in your circulatory system something isn't working the way it should, and research has consistently shown that people who experience a TIA are at meaningfully higher risk of having a full stroke in the days and weeks that follow. This is exactly why we're spending this video on the subtle signs, not just the dramatic ones, because the subtle signs are often your earliest and most useful warning. Let's start with the first sign, one that's easy to explain away as simple fatigue. Some people notice an unusual heaviness or weakness on one side of the body, often in an arm, a hand, or a leg. It's not the kind of tiredness you feel after a long day of yard work. It's more specific than that. Maybe a cup feels strangely heavy in one hand. Maybe one leg seems to drag slightly when walking, even though nothing hurts. Maybe you reach for something and your grip feels weaker on one side than the other. Because this kind of weakness can come and go, especially if it's related to a TIA, people often assume they simply slept wrong or that they're just getting older. And to be fair, plenty of ordinary aches have nothing to do with stroke. But when one-sided weakness shows up suddenly, especially if it's new and doesn't match anything you did physically that day, it deserves real attention rather than a shrug. This is where the medical community uses a simple, well-known method to help people recognize stroke quickly. It's called F.A.S.T, and it exists because these 4 checks are fast, memorable, and genuinely useful in an emergency. F stands for face. Ask the person to smile and watch to see if one side of the face droops or doesn't move the way it should. A stands for arms. Ask them to raise both arms and watch for one arm drifting downward or being unable to lift at all. S stands for speech. Ask them to repeat a simple sentence and listen for slurred, strange, or difficult to understand speech. And T stands for time, meaning if you notice any of these signs, it's time to contact emergency medical services immediately. We'll come back to why every single minute counts, but keep FAST in the back of your mind because it applies directly to several of the signs we're about to cover. Now let's move to the second sign, and this one catches people off guard because it doesn't feel physical at all. It's a sudden change in vision, and it can be surprisingly easy to dismiss. Maybe things look blurry in one eye. Maybe there's a shadow or dimming on one side of your visual field, almost like someone dimmed the lights on just one part of the room. Some people describe it as double vision that appears out of nowhere. Because many of us already deal with normal age-related vision changes, a sudden shift can feel like just another one of those changes, something to mention at the next eye appointment rather than something urgent. But sudden vision changes, especially when they affect only one eye or one side, and especially when they appear alongside any other symptom on this list, are a genuine warning sign worth taking seriously right away, not weeks from now. Let's talk about the third sign, the one so many people miss because it doesn't look like a medical emergency at all. It looks like confusion. Maybe someone suddenly has trouble finding the right word in a conversation. Maybe they seem to understand what's being said but can't quite respond the way they normally would. Maybe a family member says something feels a little off about how a person is speaking or thinking, even though nothing seems dramatically wrong. This kind of subtle confusion is incredibly easy to explain away. We tell ourselves the person is tired or distracted or simply having an off day. Sometimes that's exactly what it is. But sudden confusion, especially when paired with slurred words or trouble following a conversation, is one of the signs doctors most wish people took more seriously because it's so often mistaken for something harmless. Here's a natural moment to pause and ask yourself something. If you noticed one of these signs in your spouse, a parent, or a close friend, would you recognize it as something serious, or would you assume it was just a rough morning? Most people understandably choose the second option. That hesitation, that instinct to wait and see, is one of the most common reasons treatment gets delayed. And treatment timing genuinely matters here, so let's talk about the fourth sign before we get into what to actually do. The fourth sign is a sudden, severe headache that feels different from any headache you've had before. Not the kind of tension headache you might get after a stressful day, and not a familiar migraine you've dealt with for years. This is often described as a headache that comes on abruptly, feels unusually intense, and sometimes arrives with nausea or sensitivity to light. Because headaches are such a common part of life, we often manage them the same way every time, with rest, water, or an over-the-counter pain reliever. But a headache that feels distinctly different, especially one that appears suddenly and severely rather than building gradually, is worth paying close attention to, particularly if it shows up alongside any of the other signs we've already discussed. Now let's cover the fifth sign, which involves balance and coordination. Some people suddenly feel unsteady on their feet, as if the floor has shifted slightly beneath them. Others notice a sudden onset of dizziness that doesn't match anything they were doing, or trouble coordinating their movements, like reaching for a doorknob and missing it slightly. Balance issues are common as we age for all kinds of reasons, from inner ear changes to medication side effects, so it's understandable that a moment of unsteadiness doesn't automatically raise alarm bells. But a sudden, unexplained loss of balance or coordination, especially when it appears out of nowhere and doesn't have an obvious cause, like standing up too quickly, belongs on your radar as a genuine warning sign rather than something to quietly work around. So here's the pattern running through all 5 of these signs. Weakness on one side, sudden vision changes, confusion or word-finding trouble, a severe, unusual headache, sudden balance or coordination problems. Individually, each one can have a completely harmless explanation. That's exactly why they're so often ignored. But what connects all of them and what should genuinely raise your attention is suddenness. Stroke-related symptoms tend to appear abruptly, often within seconds or minutes, rather than building slowly over hours or days. If something changes suddenly and doesn't have an obvious, simple explanation, that combination of suddenness and uncertainty is the signal worth acting on. Let's talk about why acting quickly makes such a meaningful difference. Earlier, we compared the brain to a city relying on roads for delivery. When one of those roads gets blocked, the parts of the brain downstream begin losing the oxygen and nutrients they need almost immediately. The longer that blockage continues, the more those brain cells are affected. This is why medical professionals often describe stroke treatment as being extremely time-sensitive. There are treatments available in emergency settings that can help restore blood flow, but many of them are only effective within a limited window of time after symptoms begin. This is precisely why the T in F.A.S.T stands for time and why it says to contact emergency medical services rather than waiting to see if symptoms improve, driving yourself to a clinic, or calling a family member first. Emergency responders can begin critical assessments before even arriving at the hospital, and hospitals can prepare in advance once they know a possible stroke is on the way. Every minute genuinely does matter here, and that's not an exaggeration. It's simply how blood flow and brain tissue work. I want to gently address something many of us do, which is downplay our own symptoms. It's an incredibly common, very human response. Nobody wants to make a fuss over what might turn out to be nothing. Many people who experience early stroke signs wait, hoping the feeling passes, and sometimes it does, especially if it was a TIA rather than a full stroke. But waiting to see if symptoms go away means potentially losing the window where treatment is most effective, if it does turn out to be a stroke. This isn't about creating fear or telling you to panic over every headache or clumsy moment. It's about recognizing that when these specific signs appear suddenly, the safest and most responsible choice is to treat it seriously and get evaluated quickly, rather than waiting to see what happens next. Let's shift now toward what you can actually do, both to lower your own risk and to be prepared if you ever notice these signs in someone else. On the prevention side, there's meaningful, well-established research connecting several everyday lifestyle factors to stroke risk. Blood pressure is one of the biggest. Consistently high blood pressure puts extra strain on blood vessels throughout the body, including the ones supplying the brain, and over time that strain can make blockages or bleeding more likely. This is part of why regular blood pressure checks matter so much, especially after 55, because high blood pressure often has no obvious symptoms at all. You can't necessarily feel it happening, which is exactly why it's sometimes called a silent risk factor. Movement matters too, and this doesn't mean you need to take up intense exercise you're not used to. Regular walking, even at a comfortable pace, supports healthy circulation and helps the cardiovascular system function well. Many people in their 60s, 70s, and beyond find that a daily walk, even just 20 or 30 minutes, becomes one of the most sustainable habits they build, precisely because it doesn't feel like a chore. It's simply part of the day. Diet plays a role as well, particularly around foods that support healthy blood vessels and help manage cholesterol and blood sugar. Leafy greens, colorful vegetables, fatty fish, and foods rich in fiber are frequently discussed in relation to cardiovascular health, while heavily processed foods high in sodium and unhealthy fats are often discussed as contributing to increased risk over time. This isn't about following a rigid, restrictive diet. It's about gradually shifting the balance of what's on your plate most days. Sleep is another piece of this puzzle that surprises people. Poor sleep, and particularly untreated sleep apnea, has been connected in research to increased cardiovascular strain, including effects that relate to stroke risk. If you or a loved one snores heavily, gasps for air during sleep, or wakes up feeling exhausted despite a full night in bed, it may be worth discussing with a healthcare provider, since this is a treatable issue that connects to broader health beyond just feeling rested. And then there's something simpler but easy to overlook: staying socially and mentally engaged, managing stress, and attending regular checkups where blood pressure, cholesterol, and blood sugar can be monitored over time. None of these lifestyle factors guarantee anything, and it's important to be honest about that. Genetics, existing health conditions, and factors outside anyone's control also play a role, but these habits are consistently associated with lower risk, and their changes most people can realistically work toward a little at a time without needing to overhaul their entire life overnight. Now let's talk about preparation, because knowing the signs is only half the equation. The other half is having a plan. Take a moment, maybe after this video, to talk with your spouse, your adult children, or whoever you spend the most time with about these signs. Make sure they know what F.A.S.T stands for. Make sure they know that if they ever notice sudden weakness, vision changes, confusion, a severe unusual headache, or balance problems in you, the right response is to contact emergency medical services immediately, not to wait and check in later, and not to drive to a clinic themselves. This single conversation, the one that takes maybe 5 minutes, could genuinely make all the difference if the moment ever comes. It's also worth mentioning who tends to be at higher risk, so you know when extra vigilance makes the most sense. Age itself increases risk, which is part of why this topic matters so much for this audience specifically. High blood pressure, diabetes, high cholesterol, smoking, a history of heart disease, and a family history of stroke are all factors that raise the likelihood of an event occurring. If several of these apply to you or someone you love, that doesn't mean something will happen, but it does mean these warning signs deserve extra attention rather than being brushed aside as ordinary aches or a rough night's sleep. I also want to address something important about TIAs specifically, since we touched on them earlier. If you ever experience symptoms that match what we've described, even if they go away completely within a few minutes, it's still worth being evaluated by a healthcare professional as soon as possible. A resolved TIA isn't a sign that everything is fine. It's often a sign that your body successfully weathered a smaller event, and doctors can use that information to help lower the risk of something larger happening down the road. Medications, imaging, and further testing can help identify exactly what caused the temporary blockage and address it before it becomes a bigger problem. In other words, a TIA that resolves on its own isn't a reason for relief so much as it is a reason to get informed. Let's bring this all together with a quick recap, because I want you to walk away from this video with something practical, not just information. There are 5 subtle signs worth remembering. Sudden weakness or heaviness, often on one side of the body. Sudden changes in vision, especially affecting one eye or one side. Sudden confusion or difficulty finding words. A severe, unusual headache that feels different from anything you've experienced before. And sudden problems with balance or coordination. The pattern that ties them together is suddenness, a change that appears abruptly rather than gradually without an obvious simple explanation. If you or someone near you ever experiences these signs, remember F.A.S.T. Check the face for drooping, check the arms for weakness or drift, check speech for slurring or confusion, and if anything seems off, treat time as the most valuable resource you have, which means contacting emergency medical services right away rather than waiting to see if things improve. On the prevention side, remember that managing blood pressure, staying physically active through simple things like daily walking, eating in a way that supports your cardiovascular system, prioritizing good sleep, and keeping up with regular checkups are all meaningfully connected to lowering risk over time. None of these are about perfection. They're about steady, sustainable habits that add up. And finally, have that conversation. Talk to the people closest to you about these signs so that if the moment ever comes, nobody hesitates. Nobody waits to see if it passes, and everybody knows exactly what to do. Before you go, I'd genuinely love to hear from you. If any of these signs surprised you, let me know in the comments which one it was. If you've experienced a TIA or a stroke yourself or supported a loved one through one, your experience could genuinely help someone else watching this who's going through something similar right now. And if you're comfortable sharing, let me know how old you are and what country you're watching from. It's always meaningful to see just how many people from all over the world are part of this community, learning together and looking out for each other. Thank you for spending this time with me today, and I'll see you in the next video.